Okay, welcome everybody. I'm Wendy Bucknam and I am the mayor for this at the city of Mission Viejo and one of the founding task force co-chairs. And I am secretary of the task force nonprofit as well. And I'd like to welcome everyone today that is attending our meeting both here and online. And it seems like we are shifting to more of an online, so let's see how we progress in the future for our meetings. We are here at the County Administration North in Santa Ana. Just for those of you that are joining us virtually, we are in the county seat, if you will. Thank you for all of your continued commitment as we collaborate on policy reforms that address resident concerns regarding operation and existence of sober living and recovery treatment homes, while ensuring those who need addiction treatment receive quality services in an appropriate setting. And as a reminder, this meeting is public. It's streamed live to residents and the press and those that want to attend, recorded and will be available on our website, www.soberlivingtaskforce.com. As you know, one of the purposes and benefits of the task force is to serve as a hub of information and a collaboration for jurisdictions, elected officials, residents, and stakeholders across California. So let's get started with our agenda today. So we have some legislative updates. So let's first move to legislative updates for our group. And we'll begin with Carolyn Grinder from the League of California Cities. Can somebody grab that door for our esteemed mayor from Santa Ana? Thank you so much. Appreciate that. Okay, Carolyn from the League of California Cities, followed by Elise Ardagiano. I'm sorry, Elise. And Ryan McCarthy from Townsend Public Affairs.
Great, thank you so much. Can everybody hear me okay?
Thank you. We can hear you.
Okay, great. I have a couple quick updates for everyone today. Cal Cities has two sponsored bills that were 2-year bills from last year that are going to be moving here in the next couple of weeks. And we're definitely going to be eager to get city support as these move through the legislative process this year.
Hang on a second. We're turning you up just a bit, so hang on.
Okay, no worries.
Keep testing.
Can you hear me now?
Is that better? Everybody, can everybody hear that?
Testing, testing.
Thank you.
Okay.
Yes.
Okay. So, like I said, 2 of our 2-year bills, so bills that we introduced last year and been working on over the fall and spring, will start moving again here in the next couple of weeks. And we're definitely eager to get cities on board in support of these as they move forward this year. The first I want to bring your attention to is SB 329 by Senator Blakespear. That bill implements timelines for when the department has to respond to complaints against licensed treatment facilities. We've accepted some recent amendments to that bill that are going to allow the bill to continue to move forward. The bill currently sits in the Assembly Appropriations Committee, so it's crossed houses. It's sitting in approps. It's really close to the finish line, and we're hopeful that these recent amendments are going to help us get all the way. We introduced this bill in response to the state audit that found that it was taking the department well over a year to respond to some of these complaints, and there's nothing currently in state statute that requires the department to respond within any specific amount of time to complaints when they arise. So excited about this really being the first step. The bill is going to require the department to assign complaints to analysts within 10 days. And then the department will not be allowed to go beyond 120 days in completing those investigations. Now, that's the max. We've been told that, for high profile investigations or where public, safety is at risk, those responses will be much, much faster, but they no longer will be able to take over a year. And then additionally, the Department of Healthcare Services is going to be required to submit a report every year that's posted on their website that shows how long they're taking on average to respond to complaints, so that we'll be able to keep a much closer eye year after year on how the department is doing. And if we need to go back and work on those timelines, now that they'd be in statute, we'd be able to do so. So we're really excited about this kind of being our first step at really getting some of these timelines in statute so we can start cracking down on how long it takes the department to respond to complaints. And then we're also working on SB 490 Umberg. This is a continuation. This is our third attempt at this idea of allowing for our county partners to be able to go in and conduct site inspections themselves if the department fails to respond within specified timelines. The bill would implement really clear timelines similar to 329 for how long the department has to inspect, to respond to complaints against sober living homes. So our Blakespeare bill really focuses on licensed facilities. This Umberg bill focuses on response times to sober living homes, requiring the department to do follow-up if they substantiate claims against sober living homes, and also requiring them to do investigations into other homes operated by sober living home operators if they are found to be breaking the law. And then also that component that I talked about earlier, where the counties could go in and do those site inspections themselves. It also includes the department to turn over a lot of financial information to do better tracking of body brokering activity at the state level as well. That bill is going to have to be heard in Senate Health Committee, Assembly Health Committee before July 2nd. So we're on an expedited timeline on that one and hoping to have that hearing set here in the next couple of weeks. So please, if you could, keep your eyes peeled for information from Cal Cities about those bills. Again, that's SB 490 Umberg and SB 329 Blakespeare. And with that, Cal Cities is happy to answer any questions about our sponsored bills in this space. Thank you.
Thank you. If anybody would like to, you can join us at the tables. We have room. Please come on up. Thank you. Welcome. Terry, I see you have a laptop. Why don't you come on up too? Are you okay? You're sure. Thank you. Thank you for that report. We appreciate it. Next up, we have Elisa. Okay, so we'll punt and we'll come back to them.
I just wanted to use the city manager.
Oh, excuse me, please.
I want to join us today. I'm going to do it shortly, so we'll be here. Well,
We thank you for being here.
and cut his check already.
Thank you.
Yes, right? That same day. Grant, committed.
Very much. All three. Okay. Then let's go ahead and move off of legislative matters. If anybody has questions, this will be a chance to ask on those two specific bills. Any comments, questions? You can always come back to it too with when our next presenters, if they join, as they join. Okay. I want to just touch on the legal alert that we received from AG Bonta and Governor Newsom. As you may be aware, on June 3rd, the governor and the AG's office issued a legal alert warning local governments could face liability for relying on the Ohio House decision to adopt or enforce restrictive zoning targeting group homes. So I said that very slowly, so you really kind of understand the situation. For its part, our city, the city of Mission Viejo, has already responded to an HCD inquiry, which we have mentioned at prior meetings. We had an inquiry about the basis for our sober living ordinance, which is grounded in substantial research, law enforcement data, health and safety findings, public comment, grand jury reports, etc. So I'd like to briefly open this topic up for discussion and questions amongst the group.
It's a great topic. Thank you. If I can,
Please.
I'm going to leave shortly. Ollie, I'm sure you saw the letter on the city manager. Did we provide anything? Are we able to?
So we got a notice from HCD as just a general broadcast to all cities, but HCD has not directly contacted the city of Santa Ana. When the ordinance was passed, we recognized that it was largely based on Costa Mesa's success in the Ohio House case.
Right.
But at the same time, we were careful to evaluate some of the previously identified concerns that HCD had raised. Nonetheless, if you were to ask our city attorney, they'll always say there's some sort of risk in any ordinance that you adopt. But nonetheless, when the legal notice came out, I did ask our assistant senior city attorney to connect with our city attorney in evaluating if there's any impacts at all to Santa Ana's ordinance. So no direct communication yet. They haven't reached out to us. What we received was just that general broadcast.
And so for us, when we did the ordinance, and again, following on Costa Mesa's success, it's within the ordinance, right? We established the foundation why we presented for city council consideration. So any perspective, even from the state, right, especially for city like ours, one of the reasons why we have this task force is precisely because of the lack of, how would I say this, support, right, or ambiguity in some of the state enforcement actions. So for us, I'm not saying we welcome that type of letter, but we recognize that there might be that type of scrutiny, and so we accept that as part of the process in essence. So this is just our city, along with the mayor and the city council, doing work we're supposed to ensure we protect the quality of life for our residents. And any perspective or overview, right, from any entity, in essence, is welcome, because all our presentations as matters of public record, our rationale as a matter of public record, why we adopted the ordinance matter of public record, our diligence with staff and the city attorney as a public record. So if there was some mistake, we'll correct it. Simple as that.
Okay, thank you. Thank you very much, appreciate that. Lauren, do you have anything to report?
We're talking, we not. Ours is not the new quote model ordinance, ours is on the way that went.
Yeah.
Actually, the first set of
And we're getting-
litigation before Costa Mesa's, back in. Probably.
Yeah.
Those discussions about the ordinance stayed on the books, so it's slightly different than the model ordinance, but, you know, a lot of. We're certainly anticipating that we may hear, but we do have a compliant housing element, and we jumped through a lot of hurdles to get there, so.
Yes, many of us have. Can everybody online hear the comments? And I'd also like to know if anybody online has a comment.
Struggling to hear
Okay.
Work on the mic line.
Okay, so essentially what was said was that all of the cities are taking a look at it, and we have compliant housing elements. And certainly if any scrutiny comes in, we will, if necessary, if corrections need to be made, corrections will be made, but everything was done through a due diligence process, very public, and actually with quite a bit of information that we used as a task force. And we all coalesced and came up with a model ordinance, and also modeling a lot of it also with Newport Beach and Costa Mesa. So we have been very thoughtful in this process, and we have been very much focused on those that are seeking to recover in these homes. That is what we are doing, because we feel if we can get good operating, well-supervised homes in neighborhoods that are located in our neighborhoods, that will be good for the neighborhoods as well as the people that are being allegedly served in those homes. So that's a summary of what was said with some of my own information added at the end there. Anybody online?
Ryan from Townsend's on now.
Oh, okay. Anybody online on this particular issue before we take Ryan that would like to say something about this alert from AG Bonta and Governor Newsom? Okay, we'll leave it there. Not seeing anything. Let's jump back to Ryan. Thank you for coming.
Hello, everyone. Can you all hear me all right?
Yes, Ryan.
All right. Well, thank you guys for having me. I apologize for being a few minutes late here, but my name is Ryan McCarthy. I'm an associate with Townsend Public Affairs, here today to give a quick update on the remaining legislation that's still active in Sacramento in the sober living home space, and just to give a read on sort of where the legislature is at right now. The main bill that we are continuing to work on in this space that's still active in Sacramento is the bill by Assemblymember Davies, AB 1779. This bill relates to the inducement of participants to sober living homes. The bill is Authored by Assemblymember Davies, and is sponsored by the California Consortium of Addiction Programs and Professionals, I believe is the acronym. But this bill basically would ensure that make it so there are certain things that sober living homes cannot do to induce participants to come to their facilities. So one example of that would be they would have to provide round trip airfare for people who are coming out from out of state into these facilities. It also specifies that there are certain practices that are prohibited, to attempt to address patient brokering. So that would be like the referral of patients to these sober living home facilities. It is slightly unclear on the enforcement mechanism of those referrals. I believe that the enforcement mechanism would continue to be a fine administered by the Department of Healthcare Services. But that being said, we see this bill as a step in the right direction towards getting rid of the practice of body brokering and ensuring that these homes are providing treatment that is intended to better the patients that are attending these facilities and not cycle them continuously in and out of the various facilities, as we have seen in the past and has been highlighted from multiple members and multiple folks who have spoken at these task force meetings. There are a few bills by Assemblymember Dixon. I believe there are two that are still active in this space right now. Sorry, I'm just pulling up the bill numbers. The first one is AB 2562. It relates to suicide prevention plans that have to be in place in sober living facilities. It would require any facility that is licensed to implement a suicide prevention plan. Again, the goal is to protect the patients in these facilities. Obviously, sometimes there can be, these people experiencing some of the hardest times of their lives, and so the goal is to make sure that they have all of the protections and safeguards in place to ensure their well-being while in sober living facilities. And then the other bill by Assemblymember Dixon. Sorry, the bill number is escaping me at this moment. I apologize. But one other bill by Assemblymember Dixon I did want to flag that I know I'd spoke about at a previous meeting was a bill that I was working on with the city of Newport Beach that related to the practice of body brokering. It would have made body brokering defined in state law, and it would have, yeah, AB 2614, thank you, Hunter, that would have defined body brokering in law and made it a misdemeanor crime if anyone was convicted of body brokering by a district attorney. This bill faced significant headwinds in the health committee where it was referred. The health committee stated that they thought it should be a public safety bill. The public safety committee then pushed back and said, no, it's been correctly referred to the health committee. The chair of the health committee, Mia Bonta, is one of the more progressive members of the legislature, and she was very against any bill being heard in her committee that would create a new crime. The way the bill was written, it would have created a new crime in the health code, and she did not feel comfortable with hearing a bill that would create a new crime. So unfortunately, that bill did not make it out of the Assembly Health Committee. We're continuing to work with the sponsors and other stakeholders on this bill to hold future conversations about how we can address those concerns. I know that body brokering has been a top priority of this task force, really, for a long time, since its inception, arguably. And we want to make sure that we are able to continue these conversations, and we're looking to sit down with the health committee staff and the public safety committee staff once the legislative session is over to go over sort of the bill and work with them to figure out how we can get to a place where everyone is sort of happy with the result and hopefully try again on this in the future. That's really our goal going forward in this space. So unfortunate that that one didn't work out, but that's just kind of where we are, where we're at with that bill right now. So not going to be moving forward this year. With that, those are really the main bills that are left in the space. I know that there are representatives from Assemblymember Davies' office and Assemblymember Dixon's office on here. I'm sorry, I don't know if they've already spoken yet or not, but wanted to turn it over to see if they have any comments on their bills. I know I just spoke a lot about them, but yeah, thank you.
Thank you. Thank you.
Yeah, I think you covered everything on our end. Thanks, Ryan. Good job.
Great, thank you all. And then I'll put my email in the chat, and anyone feel free to reach out if you have any questions about any ongoing legislation in the space.
All right, thank you. Thank you very much. Any comments?
Yeah,
before we-
I just want to emphasize, Brian did a lot of work on this bill, but he made the comment that it didn't make it out of the committee. It didn't even see the light of day. It didn't make it onto the agenda. They refused to hear the bill entirely. So didn't even have an opportunity to present, some of the information that we'll be hearing about today, and all of the other information that we have gathered through the audit and these other studies or the testimonials that we required over time. So that was really frustrating, but we just have to take a different approach next legislative session and work again, hoping after we hear today's presentation, building on that we'll keep trying and hopefully get some more traction.
Thank you. Appreciate what Newport Beach is doing alongside us, so thank you. Okay, and I also would remind you that Mia Bonta, I believe, is related to Rob Bonta. I believe married to Rob Bonta. Is that correct? Does anybody know?
That is correct.
All right, thank you, just for clarification. Okay, guest speaker. We are honored to introduce our next guest speaker, who is Dr. Ilan Shira. Did I say it? Very close, yes. Very close. Okay, assistant teaching professor of psychology at Penn State. Penn State, here in California, who will present on overdose risks. He has a connection to Laguna Woods, so that's very nice. He's going to present on overdose risks in the OC Treatment Hub. Dr. Shirera's research and expertise provide a critical lens on the public health and safety challenges we continue to address in each of our communities. Thank you so much, Doctor, for joining us and for your time and for actually coming here in person today, because we assumed you would be online. So this is a special treat. So why don't you share your information? We look forward to hearing you.
Sure, thanks. Thanks for letting me speak. I am in the psychology department at Penn State University. Yeah, so I grew up in Southern California, grew up in Los Angeles, family in Laguna Woods. I'm just gonna, I wasn't really sure what information I'm giving is going to be of most interest to everyone. So I'm just gonna give a very brief, quick overview, and then I'll just open it up for questions, what people are interested in. I have, before this, I've done research on just a bunch of different health topics. Stroke, suicide, infectious diseases, lots of different things. And it was really just while doing another study that we sort of accidentally stumbled across this on overdoses, and didn't know much about it before, but once we knew what we were seeing, the data, we learned a lot about it. And we realized that there weren't really any great data sources, like directly on treatment centers or sober homes. We looked. not just not here, but also in Florida, other places, not great data. But we found that we could try to indirectly draw attention to this by using community-wide data that's pretty much available. So our first study looked at Florida, looked at overdoses in Florida, and we found that out-of-state visitors to Florida had very high overdoses. It was incredibly high among like Americans coming from any other state outside Florida. It was somewhat higher of Florida residents in Florida, but really for out-of-state residents coming to Florida, overdoses were incredibly high. We connected this to the treatment industry there by showing, one of the things we showed is that the overdoses really increased very steeply between 2013 and 2014, the first year that most of the laws around the ACA took effect. So that was one of the things we tracked it year by year. So we used death certificate data for that. So death certificate data from throughout the country. We requested this data. Then we focused on this current study in Orange County. And for this, we used emergency department records, what was happening in emergency rooms throughout California, really. And we focused on an area of Orange County where it was like most highly concentrated cities, like 10 cities with the highest concentration of licensed treatment centers. Didn't have data on sober homes. We used data from the Department of Healthcare Services just for the licensed treatment services and where they were. Identified these sort of 10 cities that have most highest density of these, and found that in this area, again, out-of-state visitors were visiting this part of Orange County. Their overdoses at emergency rooms were very high, very high. If you looked at Californians who were visiting from anywhere else in California, but visiting this area of Orange County, their overdoses were somewhat high, but not nearly as high as people who were coming from out of state. And overdoses of people who were living in Orange County were not that high. It was really visitors from out of state, especially. After that. So essentially, we were looking at, we used death certificate data and hospital data. Nothing except for that list from the Department of Healthcare Services on a list of licensed treatment centers and their locations. Everything was just death certificate data, hospital data. And I'm not sure what else. I won't go into more detail, but maybe now we just.
You want to do questions?
Questions, yeah, questions probably good sort of for
Well, that's a great overview. Very, very interesting. Of the 10 cities, you gathered information on license. You probably couldn't gather anything on unlicensed. That's part of our challenge.
Yeah.
That is part of our challenge. Of that, which city rose to the top?
Because of like the data agreement that I have, I'm not allowed in the paper or not allowed to publicly reveal like what the cities are, but I could tell you that if you were to look at a list of those cities, you wouldn't be surprised.
Are they mostly coastal?
Mostly coastal, not all, but mostly coastal. And we're looking at like the hospitals in those cities or adjacent cities, but yeah, none of the cities you look at would surprise anyone here.
Got it.
And it wasn't just the most rehabs, it was the most rehabs per population. So how densely packed, how concentrated it was.
Just to follow up exactly how you just finished that comment. So it's not so much like you said the overdose, right? But the concentration based on the population in those designated areas, right? That show the over concentration of what, drug addiction, the overdose, or the hospital visits.
Oh, right. Okay, so there were two separate things. First, we really had to start by finding which cities have the most densely concentrated rehab centers, licensed rehab centers. And so we took like the number of rehab centers in each city, each of the 30-something incorporated cities, more than that, in Orange County, and 34. And then what was the population of each city? And then so number of licensed treatment centers over the population. So per capita. And then once we had that, then we looked separately at the overdoses at emergency rooms in those cities or nearby. So not all of those cities had hospitals or emergency, so we took like the closest cities, but
Yeah, that's because a lot of our cities, we do share neighboring facilities because we're just the way we're set up as cities in Orange County.
But the reason why I asked the question, it goes back to this, the bill, right, that didn't carry any type of traction at the state level, is that this kind of data that shows at least at the very minimum, if you don't want to do this sense of penalty within the health code, at the very least, allow, for the cities to be able to regulate over concentration in certain areas, or allow the county to regulate at the county level, right? Because that's what the data is showing, right? That you have a certain region within 10 of the 34 cities, right? Even with the health facilities, where you have that it's not doing what they're supposed to be doing, right? As far as treating the drug addiction. And as a health aspect, the health commission at the state cannot ignore that.
Yeah.
Your program is not working, it's not being effective to the people you're supposed to be helping, let alone the side effects that we have there. And we can argue that 100 times,
Right.
whether or not we have the proper folks representing us. But that's the key, right? So when I asked that question, it's exactly, it says 10 out of the 34 in the cities, you have the regional contact, you see the overdose, you see the connection over concentration. So there's like linear logic to that, especially when, no offense, right, to the research, is that now we have an academic type of perspective. So it's not just a NIMBY approach that we always get criticized in Orange County. And mind you, who's saying it? Santa Ana, Newport Beach, Mission Viejo, not exactly this sense of disarray of disconnectivity, right? You're showing some major agreement among stuff that you would not see, let's say, 10 years ago, 15 years ago.
Yes, please.
So just to clarify for everyone's benefit, the nexus is the concentration within each of those cities, correct? Or were you able to fine tune it really into sort of micro level of overdoses directly from any of these facilities?
no, we couldn't. Initially, what we wanted to do is, it seemed to make sense because we assumed that like if we had a list of sober homes, we would have like looked at the concentration probably of sober homes.
Yeah.
As sort of more important. We didn't have that, so we sort of tried to build the argument that, okay, at least if you're going to outpatient treatment, most people are going to be living somewhere near there. I also just sort of wondered, like, I have the list of the licensed treatment facilities for a particular month in 2019. The department just posts it every few months. I just wondered what, for every licensed rehab, how many unlicensed ones are
That
there?
was going to be my follow-up question. Were you able to differentiate between licensed and unlicensed, but also public and private or for-profit?
Did not. No, thought about that, did not, and also didn't distinguish detox versus inpatient versus outpatient. Just wanted to get like as large a sample as possible, and put everything together. I think I looked separately, like just detox. It didn't seem to make much of a difference whether you're just looking at detox, inpatient, outpatient. It was really just very strong if you put all of them together for the license. I'm assuming that the licensed ones are most of them. And I don't even know what proportion of them.
I don't think so.
You don't think so?
No.
Because, and I think is how we define licensed versus unlicensed. Remember, as a reminder, the state code allows
6 people.
6 and under not to require a license, and you can't even require a regular rental property from a municipal code section. So that's why it's so hard especially when we ask the question, licensed versus unlicensed, right? We can't even distinguish that as a credible academic type of definition.
I'll just add to that, when we came up with our inventory in Santa Ana of suspected facilities, we estimated about 74, and then out of those 12 were licensed. So just right there as a proportion, it's like 6 to 1.
And do we have Fountain Valley online? They, I know they have some data. Why don't you share your data for unlicensed versus licensed Fountain Valley? It's like 80 in Fountain Valley.
But I do have a follow-up question to the follow-up question. So, when you said you did not look at licensed versus unlicensed, was that just as a result of like the data that was available to you, or was it a matter of just like a direction the study took?
It was purely the data that was available. It was the list that Department of Healthcare Services post publicly on their website, and there were a lot. I mean, so look in California, there's thousands. Oh, right. The other question I had, sort of don't get off it, but then you also have like the certified and uncertified. Is that totally different than licensed versus, or is that
Yeah,
something?
it's different. It's not like they're not licensed.
But the ones that are licensed, they can be uncertified, or if they're, there was no
I
distinguishing
don't
that
know
on
the
the
answer
data.
to that.
That may
Oh,
be the
Terry,
same.
Terry may know the answer.
The certified homes are outpatient, most likely, you have a residential, you have to be licensed. The governor vetoed the bill that would have required licensing for outpatient, partial hospitalization stuff. So, but in favor of a certification, it's a mandatory certification, but it's short of licensure. So, but that's tracked, so we know where those are. Those are in the data from DHCS, but those aren't sober home stuff.
So that data we knew was imperfect, but it's the best we have.
Yeah. That is part of our challenge, is getting good information out of, and that we're looking for oversight. And we're looking for ways to collect that data, and we're trying to do steps to get there with legislation, and where we haven't been very successful, but we're not going to stop trying. Yes, please.
So, a couple things. First, we spoke offline, so I kind of generally know the answer to this question, but I think it would be helpful for us here. You didn't set out to do this study to get information about overdoses relating to sober living, right? So can you kind of explain what your interest was in the subject that then led you to start to question, like, well, why is this the case? And then kind of backing out of the results that you found and figuring out that there was this.
Yeah, it was just this weird thing that we discovered that we were doing this sort of brand thing where we're looking at a study where we were just interested in looking at visitors to any large American city and what was going on with the people who lived there overdoses and the people who were visiting the city. And we're finding that among the largest cities in the United States, the overdoses of residents there was not very high, but the overdoses of visitors to these cities is incredibly high, like 10 biggest cities in the country. But then we looked at the top 100 cities and found that in Florida, I think 6 of them were in the top 100, and for all of them, it was very pronounced. Overdoses were a little higher than normal for residents, but through the roof for visitors. Highest in Miami, but also even in Orlando. Orlando made no sense. I was thinking people are going to party there, but it's like you're going to Disney World and getting overdoses. And so I came up with all these theories about why Florida this was happening, and then only just doing lots of background reading, figured out that this was something about the treatment industry there. So it's just accident.
It's important to know that, like, it's not like he had theory and then he was solving for some data that was for theory. This was something that they just were looking at, and then it was like, oh, this actually explains it. So anyway, I think that's interesting. But to follow up on the visitor piece of it, can you talk about how you determine, how someone qualifies as a visitor? So when you go to the death certificate, which address was it showing, and how did you establish that that person wasn't really a quote unquote resident? Because I think one of the things that we've talked about here, Prop 1, and all this money that the state is putting forward to care for these individuals once they're here, or at least the insurance benefits that they're being provided in order to get treatment or some type of whatever is happening in these homes, that they're being put on like a covered California plan, et cetera. So I'm just curious, like, you're saying they're visitors, how you make the distinction between.
Yeah, that was another imperfect thing. And when I say visitors, that's just sort of, they're really non-residents, like residents versus non-residents. And it just, like, the critical piece of the data for both California and Florida was they have a separate variable that codes not just where the event occurs, where the overdose happens, where they get hospitalized, but also where they reside. And so death certificates, they have where does it happen, what county of occurrence, and county of residence, and also with the hospital data, they have it too. And it seems like, just looking into it, that's really all it is. And every state seems to have a different way of categorizing this. I mean, at least with death certificates in Florida, like, yeah, if somebody's coming down there for a vacation or coming down for a few months, it seems like that the coroner or the physician, they sort of have a process where it's a bit vague. It's a bit vague, but I think they go through, if it seems like they're not permanent residents, they look at their driver's license, they try and contact, if they're living outside someplace else, they try and contact family. And so it seems like they're trying, but then you have, like, okay, if they're down here for a year, but they still have like a Kentucky driver's license, that could still be a visitor. In the California hospital data, it's a little bit less clear how the hospitals are making that, because it's less official if a hospital is doing it rather than the coroner is doing it. So that's imperfect also. You're right, people could be out here for 2 years. It's not really necessarily that they establish residency. I think it's just sort of, they're probably asking the patients at the hospital, or they're asking the patient's family or something, where do you reside? And so the data itself is just,
Well, my point was
unclear.
less about the imperfect data and more about the fact that people are coming here, and the intent of these laws initially was to treat those living in a community struggling with addiction, and instead what we're seeing is a model where people have to be brought in order to fill these beds. And so this perception or this narrative that may exist at the state, particularly among legislatures, that these are Californians, that these are people that are in our community who need this as part of the spectrum or continuum of care for substance abuse, addiction, and other types of disorders, that's maybe not actually happening. We've been struggling to figure out how to get to that data, because of course the state doesn't collect it. So I think it speaks to that, and you know, imperfect data or not, I still think it's very telling. So thank you.
I think one thing you can sort of make is that the data on the people visiting from out of state from Florida, or visiting from out of state here, out of state non-California residents, is much higher than expected, much higher in this Orange County area than the rest of California. It is incredibly higher here, but the sample size for the out-of-state visitors is less. And if you're just looking at, obviously, if you're looking at people who are within Florida going to Palm Beach County, or live somewhere else in California and are going to Orange County, there's sort of more of those people, even though it's sort of like, it's not like just explosively high. So I think, I mean, a lot of Californians are getting involved in this, or overdose visited here. But yeah, I see what you're saying. It's not, it's a difficult argument. So I will say that sort of the key to the study is, like, if you are somehow able to collect data, not on sober living homes or rehabs, if you can somehow collect data on the victims or the overdose victims, if you can somehow get, like, where they reside, that's just a very important variable to have. Without that variable, we couldn't have done the study. That was sort of the key to it. But yeah.
Do we have anybody online?
Oh yeah.
We did have someone, but I think he hopped off.
Okay, when that happens, just keep me posted, okay? Okay, go ahead.
I'm just wondering if you have totals per year on how many in Orange County is California.
Yes, it's all in the paper. So yeah, it's all in the paper. Yeah, if you look at the initial, like, if one of the two tables, it gives the counts, the number of people. So you can actually look at that. And I will say that it's sort of like it was only for 3 years from 2019 to 2021. It was just like the most recent years we had. But you can figure out per year how many happening for.
We had somebody on the-
Jared is on this Zoom and he'd like to make a comment.
Okay, Jared, please go ahead. Make a comment.
I'm letting him know he's on.
Might be muted.
Hi. Hi, can you hear me now?
Yes, we can. Thank you, Jared.
Hi, my name's Jared. I have a family member who has been body brokered just here recently, and I was wanting to comment about the plane ticket stuff. I bought 5 return plane tickets because he's came out there to he's been in Costa Mesa, he's been in Huntington Beach, and I can't think of the other city. And what would happen is they would say that thing about, hey, if you finish our program, we'll get you back home. There is no return home. He wouldn't do well, and had relapsed and was like, hey, this isn't working for me. I want to go home. They would say, too bad. Put him on the streets. They've exhausted his insurance policy now. They charge $76,000 for 9 drug tests. And these are these sober living outpatient facilities. And I have experience with South Florida and Southern California now. And it's just insane that I can't believe that they lie and say, hey, yeah, we'll get you back home. If you're just not enjoying it, or if you finish our program, we'll get you back home. And that's just a complete lie. I put him on a bus this past week. Well, me and his sister did. And that was a 60-hour bus ride to kind of, they get these amazing insurance policies. Their PPO plans, their Obamacare stuff. And I mean, we're looking upwards of $1 million that's been exhausted out of his policies. And they did it again. They put him right on, as soon as it exhausted, right on the streets. We didn't even know he was on the streets for 3 weeks. And that's all I wanted to say was the plane ticket thing. That needs to, I don't even think that's legal for them to be. They would fly him out of this little airport here where we live, $1,500 ticket, no problem. Buy it the same day. And yeah, this is the 5th time. But that's what I was wanting to say is the plane ticket stuff. I don't think that's even legal for them to be doing that, is it? To even get them out there. Sorry to be long-winded. Thank you.
We appreciate your sentiment and what you've experienced, Sarah.
You can share your contact info with us in the comments. That'd be great.
All right. Thank you.
Please do that.
Yes, I will.
Thank you. Okay, is there anybody else online? No? Okay. Carrie, did you have something you wanted to say? Okay. I didn't know if you had any questions.
Being discussed, that's all.
Understood.
Sorry.
I'll just say a couple other things. One thing.
Please.
Another way to get at it is you could ask people if you're collecting data on the victim. If you could ask where do you reside, but you could also ask even where were you born. That is also a good cue if someone's born in Oklahoma. And maybe they've been out here before and are sort of in the community, but you get a lot of people who are born in Oklahoma. It's like most of the people are born in a different state. That's telling you something. The other thing I'll say is if anybody here or online knows anyone who works or does research in the California Department of Public Health, people do research. The Department of Public Health has researchers who publish. If anyone knows anyone who works at Department of Public Health in California, get in contact with me. Just send me an email because they have, if somebody in that department is on a research project, they have access to some incredible data that just doesn't seem to be obtainable otherwise. But if you're in that department and working on it, they can get this amazing data that I don't know how else to get. So California Department of Public Health, anyone knows anyone.
Okay. Would you also briefly mention you had colleagues at the university that maybe 2 years ago now, did a study or a report on body brokering as well.
Oh, yes, there was a group that did, who were in the UCLA and UC San Diego. I don't think Sarah Klingen, I'm not sure if I tried to get in touch with her, I'm not sure, but she was at UCLA. I can give you that information. They did a very good study on body brokering and interviewing people who were victims, but also former body brokers. And then people worked at treatment centers where body brokering was happening and just got like interviews with all in Southern California, San Diego, Orange County, Los Angeles, got interviews with lots of people and just put in this, gives you a really great idea of what was happening. I learned a lot from it.
Thank you.
Wendy,
Madam Chair.
Alan was, Alan also would like to make a comment.
Okay, Ellen, please go ahead and make a comment.
Yeah, thank you, Dr. Sharira. This is a tremendous study you did. If there's any way at all to separate how many of these deaths are from people that were in programs that were taking private insurance, commercial insurance or private pay, versus facilities that were Medicaid licensed, that would be terrific to have. I mean, there's probably so few that are taking Medi-Cal, but if it's possible to do that in this study or future study, that would be wonderful data to have. Thank you.
That's a great question, and that's something I grappled with for about a month, because in the data, I can talk about it afterward, but in the data, they also have, as part of the emergency room data, they also have like expected pay.
Okay.
Just for like you're getting things, and it's like, oh my God, just like the insurance of people like who are, and I really looked at that for a long time, and it just wasn't conclusive. You'd think it would be, I mean, but it's, who knows what's, I mean, you also have to think that like you're just getting people at all the overdoses in the area, and maybe a lot of them, most of them are not necessarily from the rehab centers, but I did expect to have a lot more private pay from out-of-staters. And I can't remember if the sample size was just very low, but the numbers just weren't there. But that's absolutely, yeah, for future data, if that's possible to get something like that, what sort of insurance do they have? That's a big important variable, obviously.
Okay.
Right, but not only insurance, but were they coming out of a house that was
Right. Oh, yeah,
Medi-Cal?
you're right. That's more important. Yeah, sometimes the emergency departments, they do have records where if they were coming directly from like an inpatient treatment center, the emergency department will usually record that, but the sample size there was so small for that data set that it just wasn't meaningful. But yeah, you're absolutely right. If you can make that connection to the treatment facility, that's golden right there. Very important.
Thank you. Okay, well, this was great information. We appreciate you being here, and we will stay in touch with you. And thank you. Thank you. You're welcome to come anytime you are here in town, or if you want to call in from Pennsylvania.
Oh yeah, I will.
I love Pennsylvania, by the way. I grew up in Western New York. Right there. Okay, I like to say go Bills, but anyways, I don't. All right, thank you for that. Let's next step into, Peter, I think you have some information, and along with Chris, on an update on our outreach and research initiatives, including any progress, or I guess, are you going to do it?
Yes.
Okay, and any progress on public awareness studies or stakeholder engagement?
Thank you. Yes, just a quick update for you. The research ad hoc has been meeting. We've met several times over the last several months, and University of California Irvine School of Social Ecology, as well as the Department of Public Health, School of Public Health, have both agreed to work with the task force to finalize frameworks around qualitative and quantitative research and surveys that will bring additional academic data to the table for this organization to utilize, identifying future priorities for the task force, as well as legislation continuing to work with both of those schools. Dean John Gold and his team have prepared a draft framework for the research ad hoc, which has been reviewed. We're following up on some various questions and some feedback from the elected officials who were involved in that ad hoc to make sure that the framework is sound.
Just from the nonprofit and the 501c3 update aspect, the 501c3 has been established. The nonprofit board has started meeting. It is chaired by Mayor Valerie Mesqua. And we have initiated sending out invoices to the various cities that have been directly engaged over the last couple of years to encourage their investment so that we can do this type of outreach in a very collaborative and more robust, dynamic ways. That funding will go toward communications and advocacy and research. So we're hoping that people will take advantage of that. The ACCSC will be assisting with management and oversight. We've also established a consulting for accounting services through 1OC, which works with a lot of nonprofits. They're nonprofits themselves. They work with a lot of NGOs and nonprofits on accounting services. So the oversight is in place for any funding received. And I just like on a point of additional contribution to today's discussion, I'd like to recommend that both the legislative committee as well as the nonprofit board schedule a discussion on response to the AG and the governor, really bringing to light some of the data that they may be overlooking.
Yeah.
I certainly hope it's something they're not aware of, given how strongly worded that message was, but we clearly have people being harmed in many of these facilities, and it's very important that I think the task force goes on record in response.
I think you're right. So we will work on that. Does everybody agree with that, by the way? I mean, no, you're on this task force. Give input.
Yeah, I think it's a great idea.
Yeah,
And it's better coming from the task force versus individual cities.
absolutely. Well, I know that a lot of this work that you have been doing as our supportive team is and any kind of any surveys that we needed. It does cost money. So I do want to encourage those that are participating to make sure when you receive that information, that invoice and that call, follow-up call from our team, please respond. Please step up, because that's how we're going to continue to make a difference. We've gathered a lot of information at this point. We need to keep going and make a difference. We have a chance potentially next year, if not some steps this year. So just to wrap it up, I just want to say that I really do want to make that ask that each of you invite somebody, whether we do it online or whether we bring them to our meetings, and especially those that are outside of the Orange County area, because again, we want to demonstrate that this is something that many areas are interested in. And as long as that is perceived to be Orange County focused, I want us to be, if that's going to be less impactful to our statewide efforts. So with that, today's meeting has concluded, and I would encourage you to stay if you'd like and connect with colleagues afterwards. And I want to thank our guest speakers, and I want to thank also our speakers that were online and provided comments, and for the hard work that you're doing, and also for Orange County Register, Terry Sforza, for being here and being steady on this reporting. We thank you for that, because that is also another piece of what needs to be out there so the public knows. So because again, we're about being transparent, and anybody can attend these meetings, and we welcome everyone. So thank you all for your dedication and participation. Thank you.